Denise, I think you're muted.
Thank you. Thanks, Anoo. I muted myself. Okay, let's start again. Hi everybody. On behalf of PRECI, I'd like to thank you all for joining us today. I'm Denise Luscombe, the chair of PRECI, and really pleased to see so many people online. We had over 350 people register, and we've currently got near 140 people, it looks like, actually online at the moment. So before we start, I would like to acknowledge the traditional custodians of this land and the lands where you're joining us from today. I'm on Whadjuk Noongar Boodja in Western Australia. I pay my respects to elders past and present and to any Aboriginal and Torres Strait Islander peoples here today. I'm going to start just by doing a little bit of an introduction or a PRECI update as we allow people to come into the webinar. So I thought I would start by just, I think, celebrating. We were extremely pleased with the positive feedback about the conference held in Adelaide in May. It was great to have such an energised community who were there to share and network and just, really connect during those few days. And I think many of us went home really sort of buzzing and inspired from the conference. There is a conference newsletter that you can see there, which you can get from our website if you would like to get some more insight into that. But we were also very excited about the funding that was announced at the conference that supports and extends the work that PRECI is doing in supporting the implementation of the National Best Practice Framework for Early Childhood Intervention across Australia. And currently the activities that are included in that funding are still being finalised. But we also remain committed, even though we have that funding coming up, we do remain committed to continue to hear and gather insights from across the field. And so we've been doing a road trip, as many of you know and have been involved, and our next places to visit are Darwin and Alice Springs at the end of July. So for those of you who live and work in the Northern Territory, we would love to see you there, and you can register using that QR code, or you can go to the PRECI Humanitics page, and it's also available on our website. So as well as being committed to listening to the field, PRECI also sees it as critical that we continue to provide the sector the opportunity to engage directly with those who are willing to share their knowledge, their insights and expertise, and in this case, those who've been involved in the development of the Thriving Kids model. So it's pleasing to see the framework consistently referenced in the work happening regarding thriving kids, and PRECI will continue to advocate that it's considered and truly forming the basis of practice in this area so that children and families in Australia receive high quality services and importantly achieve the outcomes that should be expected. So this webinar is the third in a series of webinars hosted by PRECI, and the focus of today is the early childhood education and care sector. We had many questions about this in the last two webinars and its place in the Thriving Kids model. You've all received in your email and in the link in the calendar invite 3 documents. One is the framework, the next is the Thriving Kids Advisory Group, and the last one is the PRECI Thriving Kids or NDIS redesign discussion paper. So we want today to be as interactive as possible, ask you to utilise the chat to do this. There may also be opportunity during the Q&A section, which there is plenty of time for, to come on video and ask your questions as well. Please ensure all questions and comments are respectful and inclusive, and please note that the session is being recorded. So let's begin. We've got a fair amount of people in. Yep. Well, they're still coming in, but let's head off. So firstly, I would like to introduce our special guest, Samantha Page, who is CEO of Early Childhood Australia and also a member of the Thriving Kids Expert Advisory Group. Thank you very much for being with us today, Sam.
Thank you. It's lovely to be with you.
Thank you. And I'd also like to introduce Dr. Anoo Bhopti, who is a PRECI director and who is also a member of the Thriving Kids Advisory Group. So welcome back, Anoo. And we also have Dr. Susanna Gavidia Payne with us as well. And Anu, Susanna, and myself are on the PRECI framework team, and we'll be monitoring the chat as well. So, Anu, we'll be commencing with an overview of the Thriving Kids model, and then Sam will be discussing key aspects of the Thriving Kids model in relation to early childhood education and care, and any key discussion points around the involvement of ECA in this model, as well as, Sam, any updates that you can provide in the discussions that you're having of where things are sitting at the moment in the various states and territories. So, Anu, shall I hand over to you? And are you happy if I put the Thriving Kids model slide up?
Yes, that'd be great. Thanks, Denise. And
Yep.
hi, everyone. Um, so, yes, I had the absolute honor to be on the expert advisory group with Honorary Minister Mark Butler and a fantastic team of advisors, and worked together with them over a period of few months. And we had a few full day sessions where we brainstormed, and then there were lots of deep dives, which a few of you might have joined. So it was a great way of getting everybody's perspectives into the design of the Thriving Kids. So this is what the model looks like. I'm fairly sure most of you would have had a look, but I will quickly summarize so that we're all on the same page. So the Thriving Kids model is it's meant to be a stepped model of care designed to ensure children aged 8 and under with developmental delay, autism, or other neurodevelopmental differences receive the right supports at the right time in environments where they live, learn, and play. And so people who work in the EC sector are absolutely crucial and essential to for the children to thrive and for their families to thrive. So there were different components of one. The most important part is early identification, where developmental concerns can be identified by parents, carers, early childhood education services, so ECECs, primary schools, GPs, health nurses, and pediatricians. So often we have seen that that's where most of the concerns get picked up, and the emphasis is on recognizing these concerns early so that we can have better developmental outcomes for children and get in early. So that was a lot of work was done around that piece. Then there's multiple entry pathways, as you can see in the model. So families can enter the system through multiple access points, online, community services, GPs, allied health. So this was our vision, and so that's really evident in the model. So we were quite happy to see that came out when the model came out. There's no wrong door approach. So that was what was discussed a lot, that, if there is a concern, there needs to be an entry point, and that children's functional needs, together with their family circumstances, strengths, are used to determine the most appropriate level of support. Then you can see the continuum of supports. That's also a stepped model, with most families begin with best practice universal parenting supports and information. So it's absolutely crucial in the early years for parents to receive support within the universal settings, so not all of them need specialized settings or specialized programs. And so is there a way that we could work in that universal system which already exists, where we can start to include lots of those parenting programs or parent supports, or information, peer-to-peer support, or community-based things. So that was a lot of work, a lot of talking and discussion around that. And children with additional needs can also access. So that was the universal. Then there was the targeted support. So there's again different levels of that. But if they did need more targeted supports, such as some allied health interventions, or family capacity building, or early childhood intervention services, early needs, so then those would come under the targeted supports. And children with significant and permanent disability would continue to receive individualized supports through the NDIS. So there was never that this is Thriving Kids was never meant to stop children who have significant permanent disabilities to go straight into the NDIS, but it was more so a system where children get missed out or children are on wait lists and they might have a mild support need or a moderate support need, can start to access services by universal systems and if they need targeted supports, then they could get the targeted support. So it's meant to be an enabling system where the model is supported by system enablers, which is where a lot of work has to be done. And I think PRECI is spending a lot of time and energy thinking about this workforce capacity building. How can we help build the workforce capability? And are we using digital child health records? So there was different things that were thrown out, but I think a strong focus and need we feel is the workforce capability, building that, coordinating between services, linking in with education, health, and different disability systems. So it was not, it's not a funding model. It's not like the NDIS that lent itself to a business model, but we're hoping that it is a coordinated service delivery model that matches children families to the right levels of supports based on their needs and empowering families. So, have I addressed most of the things on the model? Yeah, I mean, that's in short what this model is. There's a whole document that goes with this that was circulated. So, and it's freely available as well. So, Sam, if I've missed something, please jump in, or Denise or Susanna.
Anoo, just maybe before you hand to Sam, there is a question from Kerry, which is about who is defining mild support needs and
Oh,
moderate
yes.
support needs. Yeah.
Yeah, yeah. So those are the assessments that people will be planning on implementation. So who defines? What we thought when we were talking about is that any concerns that the parents have should be taken on board, and the main thing is no one misses out. So this is the next level of who is defining mild, moderate supports and the funding that's attached. But I think before that, it was about every child gets in or every parent gets in. So yeah, I don't have a clear answer to that assessment piece. So I believe there will be some sort of assessments that will determine or define. But I think remembering that every child needs, if there is a need or if there is a concern, that they need to be in or get into the model.
Okay. Sam, are
I
you?
know,
Oh,
sorry, I was just wonder if you could clarify. Well, it's kind of clear, but the issue around children who are at the NDIS or who are about to enter the NDIS, they would actually have access to all those supports anyway, like the
Yes.
information,
Yep.
the information, the assessments, or the monitoring, or whatever else it is. It's not just for children who haven't who have entered the NDIS,
Yes.
haven't entered. It's for everyone.
Yeah. Yes, I think it's important to remember that. So, yes, sir, I've seen your next question as well. Will allied health services under targeted supports be government funded? So, I don't know all the answers to that, but we are imagining that under targeted supports, there will be a place for allied health services. And yes, it is not replacing ECEI, but it's complementing it. So, all of those things definitely still hold true. And if children need significant supports, then they will definitely be in NDIS. So no one is pulling them out from NDIS and putting them into Thriving Kids. That was never what we had discussed.
okay. Sam, are you happy if I spotlight you? I'll take down the. I'll stop sharing my screen,
Sure.
and we will. Yeah. Thank you for. I'm just going to find. Here we go.
You're very welcome.
Thank you, Sam.
And look, I'm just going to ramble on a bit and talk about the process and what we know and what we don't know. And then I'm very happy to make this quite interactive and Q&A. And I didn't do a PowerPoint because things are changing all the time. It's a bit hard to keep up, isn't it? So we'll just go through kind of what we know. I mean, I absolutely, it was such a privilege to be part of the advisory group. There was a lot of goodwill on that advisory group and a lot of collective wisdom across primary education, early childhood education, allied health, GP, representation, nursing profession, really, you know, a lot of people who really know what they're doing in their own profession coming together with a sense of goodwill to try and build a system that works better for young children. And I think those of us that are close enough to the NDIS and how it's working for children under the age of 9 would recognise there are a lot of children that are not getting what they need, that it's very much a model built on a sense of knowing exactly what support somebody needs and being able to finance that in an individual approach kind of methodology works for some children, absolutely. Children with quite significant disability, a clear functional capacity limitations. The NDIS still is the right model and will continue to be the right model. But for a lot of children, particularly children with neurodiversity and developmental diversity, developmental delay is a term that I'm a little bit uncomfortable with. Children aren't always delayed, but they may be developing differently to their peers. The NDIS isn't that we don't have a clear diagnosis and we won't have one for some time. And meanwhile, children are missing out on the kind of early intervention and support that might be appropriate to them. And approaches to providing those supports, such as the early supports stream of the partner in the community services funded under the NDIS, haven't been very effective because they're seen as streaming children away from the NDIS, and there's a penalty for families in doing that. So we've really not been able to deliver the kind of early support, universal entry points that we might like to provide for children under the age of 9. But I would try to, as Anoo has said, never in our conversations around the advisory group was this about pulling children out of the NDIS, but rather providing a better, a more sensible approach to how we support children in the early years and still allowing for that pathway to the NDIS for the children and families that need it. So I think one of the most important things about the report, and I did put a link to the report that as Anoo was sharing the diagram on universal and targeted supports, but I wanted to take one step back because I think one of the where some of the rich conversation was happening and one of the most important things we landed, I think, is in the principles. Because the principles of Thriving Kids are child-centred and are strength-based and not deficit-based. And this is a really important distinction, I think, from where we have landed with the NDIS. And the NDIS might not have intended to be a very deficit approach, but it has turned into that in terms of this sort of functional assessment approach and focusing on support needs and therefore funding eligibility rather than diversity and inclusion and early intervention, and seeing the early years of a child's development as quite fluid. So the fact that we're taking a child-centred approach and a strengths-based approach, I think, is really important, and we need to hold government to that. That is what they have committed to. We need to make sure that we're upholding that principle. I think also the evidence base, so wanting to make sure that interventions that are provided, that service platforms are provided, both in the universal space and the targeted supports, are based on evidence about what works and what is most effective and appropriate to a child's age and the setting in which those supports might be provided. The focus on everyday settings, and that does speak to the role of early childhood education and care services, as well as families, the home environment and community environments as well, and schools as well, which I'll come back to. And this real focus on holistic approaches and integrated interprofessional work, which I think is a real opportunity for allied health professionals, early childhood intervention specialists, to work with early childhood educators and child maternal health practitioners and other people working with young children and families to really drive some investment into that interprofessional practice that many of us have said is needed, and some do very well, but hasn't really been resourced at any kind of scale. So generally speaking, early childhood educators are trained to do early childhood education, allied health practitioners trained to do allied health. We're not seeing that investment in how to work together to wrap around a family and children and provide a cohesive and integrated set of early intervention supports. And I think that's a real opportunity for us under Thriving Kids to actually drive some investment into that and to do some training together and to develop some service models. And that builds on the work of the best practice framework, absolutely. And there was a lot of recognition around the advisory group, and you see it reflected again and again in the report, that everybody wants to make sure that the best practice is the foundation of Thriving Kids, and that that framework is informing the decisions all the way along the line. I think we also spent quite a lot of time talking about making sure that supports are flexible, are culturally responsive and appropriate, and may be delivered in a diversity of settings in a number of different ways in order to account for the different needs of different children and families and their communities as well. And lastly, the principle on workforce development, I've kind of touched on that interdisciplinary work, but I do think that there's a real opportunity to say, we might have our professional disciplines, but we can also come together to develop the workforce in a way that works differently in the future. So that's quite an exciting moment in time. I think there is quite a bit of confusion about, well, how's it going to work? And I think Anoo, I don't know if I'm talking for other members of the advisory group, but I certainly was a little bit surprised when we got to the end of that process and had the report and had an agreement on how to go forward, to find that it's very much now in bilateral agreements with each state and territory, which means each state and territory might do things slightly differently. I do think there's still a commitment at the Commonwealth level and across the governments, both state and territory and federal, to try and have some consistency, certainly consistency in the principles and the way the funding might be used, the kind of supports that might be provided. But it does make it a little bit more difficult to be definitive about implementation, because each state and territory is now grappling with which of their agencies is going to take the lead and how are they going to roll out their funding commitments. And we might see, we're hearing differences in terms of some states looking at very much a public delivery, where they are going to put the money into their own workforce and their own service delivery. Other states and territories are already testing the market amongst not-for-profit providers, and others are still, I think, undecided in terms of what the exact mechanism for funding will be. Will it be a payment to practitioners individually, or will it be a payment into services? Some of the universal obviously makes sense to coordinate at a national level and will stay with the Commonwealth. But I think much of the interventions that are involving early childhood intervention specialists, allied health specialists and educators, probably more likely to happen in the community and or in natural settings. I do think in terms of that state by state implementation, there is an opportunity for professionals across the allied health and early childhood education sectors to get involved, to try and be involved in co-design opportunities. And there is the opportunity, of course, then to try and make sure that where we have flexibility in the way services are provided, that it matches the communities that we're working in and the needs of children in those communities. And so we're not building a one-size-fits-all model across an entire jurisdiction, but rather allowing for things to be done differently, perhaps in regional, rural, and remote communities, and communities that face different challenges. So that is there's a workload associated with being involved in that co-design. I absolutely recognise that, but I would encourage people to get involved in that where they can. And of course, the peaks like PRECI and ECA, we're doing our best to make sure that we have people around the table across each of the jurisdictions helping to inform some of those co-design conversations. In terms of my work on a day-to-day basis is in early childhood education and care primarily. And we did put a lot of ideas forward during the consultation process on Thriving Kids about the potential role of early childhood education and care in this space. And one of the things I just wanted to touch on is often I don't think there's a good understanding of just where children are. So there's often a number thrown around like, oh, only 40% or 60%, depending on who it is, of families are using early childhood education and care, but that's actually a misunderstanding. That's an averaging out across the age. What we actually know is that because of paid parental leave, which is a fantastic thing, we're all for paid parental leave. In the first year of life, a relatively small percentage, about 10% of children are coming to an early childhood education and care setting. So we would absolutely say in that first year, child maternal health are by far the primary platform. GPs are also really important. Playgroups, places where families go to find information and to network with each other are the primary potential connections to families and children. By the age of 1, we have about, numbers vary, but 40 to 50% of children start accessing early childhood education and care. And by the age of 3, that's well over 70%. And in the year before school, well over 95%. So early childhood education and care is a critical platform that the majority of children, by far the majority of children, will access at some point before they transition to school. So it should be seen as a primary platform. However, it's not just about working with children when they're in the service, engaging with educators, but rather we want to try and position early childhood education and care as a place where other professionals can work with children and families and have a good influence also on the home environment, and potentially work with children across settings. So they might work with children in a clinical setting sometimes, they might work with children in their own home, they might work with children in the early childhood setting, and they might do that by forming a team around the child and around the family and influencing practice across the service that the child might attend, and other professionals that families might be getting information from.
Because we need to take that to get your Ugg boot.
I think we've got another.
Because we do.
Person speaking. The other thing that we did talk a lot about in terms of the potential interprofessional practice between early childhood intervention practitioners and allied health practitioners and early childhood educators is about understanding each other's language, understanding each other's work, and working collaboratively together. So we don't want practitioners necessarily coming into services removing a child, and the school sector were very clear about this too, removing children to another place and doing one-to-one interaction and then popping the child back into the group setting. Rather, we want to work with the education team around the child to adapt the program and to embed in early intervention into the work that's being done every day, not on discrete sessions. Now, that's not to say there isn't sometimes a place for one-to-one assessment or conversation with the child or family, but really we want to implement that best practice framework and work cohesively around the child and family. And there is a cost to that, and I think the question earlier about who pays for this, I do think the intent is to have a publicly funded system without big out-of-pocket cost to families. But we are going to have to do some work on what that costs and what that looks like and how that is funded from one jurisdiction to another, because we don't have one single financing model that's being applied across the board. I think the other thing that we have talked about a little bit is where are the relationships of trust. So teachers and educators often are the first to identify a child might be having some developmental diversity or delay or difficulty, and early conversations with families. And I have pushed back a little bit. There's been a bit of an implication that early childhood educators need to be sort of trained in child development, I would argue that that is core business for early childhood educators. What is more difficult is knowing how to where to refer children for additional support, particularly when it's very early in the identification of possible developmental difficulties. And I know we've had issues from state to state around very long waiting lists, referral barriers, difficulties having those conversations with families. And then also recognising that the current model of funding for early childhood services doesn't provide for a lot of non-contact time to be doing research into referral pathways and to be reaching out to other professionals. And we've got problems with sharing information. So we did talk about in the development of Thriving Kids, and I think we should continue to talk about this with state and territories now. We need mechanisms for sharing information, and we need mechanisms for funding those additional hours that are not about providing early childhood education and care to a specific group of children, but rather to providing that broader, more holistic support to children and families. I think we've got a way to go there. I think there's also been a bit of confusion about the inclusion support program and how it operates in the early childhood sector. The inclusion support program funds additional capacity within early childhood services to respond to the diversity of children and children with additional needs. It's about increasing the number of educators that are in the room. It's also about bringing in experts that can assist with adapting an education program, changing the way routines and rituals that the service might adopt that might cater better to a child, for example, with neurodiversity, identifying equipment or sensory tools that might assist a child to be integrated into the early childhood setting. But it's not replacing or an alternative to early childhood intervention or the work of our allied health practitioners. And so we're going to have to defend that, I think, going forward, because there has been some confusion outside of the sector thinking that these are duplications, and they're not duplications at all. But we're going to have to articulate that, I think, as professionals and peak bodies. So I'll probably leave it there and just take questions. I haven't been able to focus on the chat while I've been talking, but I'll possibly scroll back. Is that the best way to do it?
Yeah, Sam, I'm just answering what I can. But if there's one question, so some of the questions are related to implementation. So unfortunately, we don't have those answers yet because it's still that's some of that is beyond our knowledge as well. There was one question about how will an early intervention center actually be funded to deliver targeted allied health supports under Thriving Kids and for a large cohort of children with low to moderate needs who do not have access to NDIS packages. What is the actual subsidy mechanism families will use?
Good question. Yes, that is the level of implementation that we don't have yet. So what we know is the quantum of funds that are going into Thriving Kids and how that's divvied up loosely across the states and territories. We know the Commonwealth are putting in some money. We know the states are putting in some money, but we don't have a finance model for the way Thriving Kids will be funded, other than to say, I'm pretty confident, I think you would agree, Anoo, that it's not going to be an individual funding package, right? So it's not going to be NDIS-like. It is going to be community-based. I doubt that there'll be a co-contribution, to be honest. We wouldn't rule it out, but I doubt it. I think that it'll be more about whether the funding is put into community and public health settings or into embedding additional supports into schools and early childhood education and care settings, and some of it being digital and online and more universal supports for families. But the exact breakdown of what that looks like is not known yet.
So there is another question by Tanya. Do we know what level of implementation will occur by October 2026, then 27 January, and finally January 28?
I think we'll be lucky to have just a clearer understanding of the states and territories' starting position by October this year. I think a lot of the states and territories are currently, they're either in consultation or they're testing the market to see who's willing to provide and what that might be, what that might look like. So I think we might have a better sense of that by early next year. And of course, everybody, I think, is hoping to see full implementation by 2028.
Robert has actually asked about consultation in the more rural and remote areas, Cape York, Torres Strait Islander region. Yes, do you know about that, Sam?
Um, Again, because it's jurisdiction by jurisdiction, it's a bit hard to give a all over answer. I mean, I would just look out for consultation opportunities, and certainly through the peak. So Snake, for example, has been very active in this space and is providing lots of advice to government in terms of remote communities and ACO-led service delivery models and how that might work. But we would also be expecting there to be some regional consultations, particularly once governments start to decide how they're rolling it out. What are they, where it's going to sit in the bureaucracy, because in some jurisdictions that's in disability units, in some it's in health, in some it's in education, some it's community services. So it's a little bit different state to state, but each of those will have then a way of working across their jurisdiction. So whether that's regional areas or districts, health districts, etc. I would be expecting, and if not expecting, then asking for consultation at the local level.
And that was a bit of a worry for us when we went the advisory committee, that it would, that the program, when it gets rolled out, the state-based model will, I don't think we had that intention when we were in the Thriving Kids Advisory Committee. Sam, would you agree?
Yeah, I think it was a bit of a surprise at the end of the process.
Yeah.
Sam, there is a question from a participant from ECA Northern Territory. She would like to ask.
How lovely.
Hi, Sam. It's Michelle and Viola in the Darwin office.
Hi.
This is a question for the advisory board as well. I was just looking at the universal parenting support. Is there it says that it's there's going to be a light touch for someone to access those? At the minute, do you envisage parents just self-refer them into those parenting supports, or?
Yeah, look, it's a really good question. So I think some of the funding is targeted to expanding content on the Raising Children website to include more content on neurodiversity, more content on developmental diversity, things that parents might be looking out for, things that parents might gain a better understanding about the way children develop speech, for example, the way children develop physically. So I think but I don't think that, when parents are concerned about something and Googling for that, is that what comes up? Is it too passive, is my question. So I think we'll be relying on professionals to connect families to those sources of information and any kind of interactive supports that might be available to them on those platforms. I think there's still a role for practitioners and professionals that are working with families to be aware of that and to be using that when they're working with families.
Thank you.
Ooh. Okay, there's quite a long one. I don't know if you can read it there, Sam. Have you got it's right at the bottom? Oh, it's from L. Does ECA provide practical examples or case studies of successful interprofessional collaboration? Yeah.
Great question. We do, but we'd like to do more. So we have done the statement on inclusion of children with a disability with was ECIA, now PRECI, and we're in the process of talking to people about refreshing that. We've also done some online learning with ECIA VicTaz, which I believe sits on their platform, which is about working interprofessional collaboration. And we've just done some online learning courses for the South Australian Office for Early Childhood Development. I'm not sure whether they're available yet, but I think they're going to be freely available to early childhood educators, funded by South Australia. But luckily, the internet knows no state boundaries, so anybody will potentially be able to access those. But I do think this is where we could do with more investment being driven. I think we have to sort of push back against the notion that it's not about training educators to be therapists, and it's not about training early childhood intervention specialists to be educators. That's too much of an oversimplification. But what we can train and provide support with is that interprofessional practice and that collaborative approach, and better understanding each other's professional skill set, and how to leverage that, and how to work more in teams around children and families, and not individually.
Sam, there's a couple, I know you've mentioned around the use of the internet. There's a couple of questions there, or just statements really, about the challenge with lack of internet, or literacy and health literacy not being spoken about. I think in part of the funding, and you may know more and had discussions, but I think part of the funding the federal government has put aside is also around a parent helpline, so it's on the phone rather than having to access through the internet exclusively. So that,
yes, no, I think you're right. There is a helpline as part of the package, and I think there's also a commitment to doing more proactive, like animations and video content, less relying on the written word, and trying to be more effective at promoting this sort of content out through social media channels and other things, so that families are seeing that content without necessarily needing to go looking for it. But again, I think those trusted relationships that families have with their GP, with their child maternal health nurse, with their early childhood educator, are really where we can leverage those opportunities for having conversations with families, and for making suggestions, and both, sometimes allaying concerns, and other times raising concerns. I mean, both can be complex and difficult, right? But more investment in that interdisciplinary practice, and sharing information. I mean, I think sometimes, just even as professionals, you'd like to be able to pick up the phone and just say, I'm just not sure about this. I'd really like another opinion. I'd really like to get, I don't necessarily, I'm not making a referral at this stage. I just want to have a conversation. And I don't think we are resourcing that as part of the system, and maybe we could.
Yep. Oh, any other questions there I've missed as I've been going through? Anybody else want to come online and ask a question of Sam?
There is a comment there about autism, and this is, I think, particularly interesting because one of the complexities for the NDIS has been the very unexpectedly high proportion of children being identified as having autism, but that pathway being quite complicated and taking a long time. And in the Thriving Kids space, we were really hesitant. We didn't want this to be a program where you had to have a diagnosis already, or you had to have, suspected autism in order to access services. This is not what this is about. We want really soft entry points, universal entry points. However, it's certainly true that early intervention for children who might have autism, who do display some neurodiversity, is a key area of focus for Thriving Kids, and that is it is. I think there were a number of us that were surprised when the media release at the end of the process said, "Oh, this is for children with autism and developmental delay," when we had all the way through the process said, "No, it's not." You're not. That implies a diagnosis, so that implies a definite. That implies a deficit approach, to be frank. And we've built we're trying to build a program that takes a strength-based approach. However, there will be a strong focus on that very early identification and effective early intervention for children who may one day have a diagnosis of autism.
Yep. Sam, there's another question or statement from Lisa about those families who may not have a family GP, don't go to childcare, they don't have phone, internet, no money for data. I don't know what the conversations were about that, or the conversations around child and family hubs, where it's more a local or gathering rather than a formal GP childcare sort of situation.
Yeah.
Yes, I mean, there was conversation about that, and certainly the hubs that are, rolling out, and there are quite a number now of good examples of hubs and integrated approaches were discussed. And we also were feeding in examples of, say a preschool where there are drop-in clinics with allied health professionals that are available to any child, not just the children that are enrolled in the service in the preschool, but rather to any child, which might be a sibling, might be a new parent. That can we make those access points more flexible so that you don't need to have a regular GP or a regular child maternal health visit in order to access some of those very early assessment, early intervention services. Again, what's tricky is because each of the states and territories are going on their own approach to this, we can't be sure that model will be funded in all jurisdictions, but we can certainly continue to advocate for it. And that the point there from Stacey, I think, is yes, I am very conscious that the way we finance early childhood education and care, particularly, using the childcare subsidy, really doesn't allow for extra work to be done with children and families outside of the education and care setting, and we do need to find a way to resource that. And I don't think the inclusion support program is adequate for that. So I do think we need to find some additional resourcing mechanisms, and Thriving Kids might be part of that. We might also be talking about reforming inclusion support. But some way we need to, if we're going to ask educators to be part of a team approach around a child and a family, then we need to resource that function.
And also there was the 3-year-old check as well that was talked about from the federal. I hope that goes to federal funding, and then that's another way of getting to the families that you were talking about, Lisa, hopefully, because then that screening process can also help with that.
Yeah. Sam, there is a question there from Sarah about the advocacy that PRECI, ECA and PRECI can do to be able to support what you are discussing, as well as the best practice framework for early childhood intervention. Yeah.
Yes, I mean, certainly the best practice framework is something that we're all very supportive of, and it's good to know that there's additional funding to implement that framework. But also, I would encourage people across the PRECI and ECA networks and other professional networks to get engaged in the Thriving Kids consultations and to provide examples of what you think is good practice. That's what we've tried to do, is put forward good practice of embedded supports in natural settings, what that looks like, into professional practice, what that looks like. But it's not everywhere now because it's not properly resourced, it's not properly recognised, and it hasn't been supported. So we've got to find those gems, those examples of what it could look like, and keep putting those in front of government.
Yeah, I think there is a follow-up question from Sarah there. Sam?
No, online.
Sorry, it's moving quickly, so
no, she's raised her hand.
Oh, go for it. Yes.
Yeah.
Oh, no, so I was just wondering how we can, I mean, we've definitely done that in New South Wales, and I know there's a number of providers, non-profit providers, that when we saw the draft guidelines in New South Wales have put in, but is there any way we can get in some kind of coordinated approach with ECA or PRECI members to actually, so it's not just up to the individual organisations or individual practitioners? Is there going to be some kind of coordinated approach in each state as these guidelines come out in response to them? Or is it sort of down to individual members? I'm just wondering.
Yeah, look, I think we'd be keen to explore that, Sarah. I think, PRECI and ECA have a good close working relationship and would be, I'm not meaning to speak for you, Denise, but I think we'd be happy to collaborate. I think we were all a bit surprised when we saw that EOI come out in New South Wales because it seemed very early. Most other states and territories are still at a much earlier point of trying to decide, what their model might look like, whereas New South Wales kind of went straight out to test the market quite quickly. But, maybe that will better inform their deliberations about what models are appropriate and what isn't. I'm not sure, but very happy to collaborate at the state and territory level, as well as continue to collaborate at the national level to try and keep a watching brief across all the jurisdictions.
So we can follow up, Sarah, and just see what we can do with that.
Yeah, that'd be great. I think if it's coming from some of the peak bodies as well as from the individual organisations, that'd be more powerful.
Yeah.
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 Sam, there's a couple of questions. There's one specifically around early childhood educators. Francis has asked, can you speak to what an early childhood educator might experience or identify when there is good collaborative or interdisciplinary practice?
Yeah, so we did get some terrific examples of this. So, for example, I spoke about a preschool where they have a number of allied health practitioners that visit regularly, that run outreach clinics from the preschool, but also spend time within the preschool where there are some children with identified speech or physical development needs, and those needs have been, identified, and there's a plan. But they're working with the education team overall. But they're also lifting capability of the whole team generally on issues of speech development and physical development. So it's not limited to just the individual children that might have been identified with some developmental diversity or difficulty. And I think those there are some excellent examples. Gary, Broadmeadows. We've had lots of conversations about where there is embedded early childhood intervention and embedded allied health. Those models where they work as part of the team all the time. It's not just coming in a reactive kind of sense when there's an individual child. I think what is difficult about those models, I think we all agree, reflect the best practice framework, reflect good practice, work really well. Can they be scaled and embedded in every single early childhood service across the country is a question. Do we have the workforce that would allow for that? Do we need that? Or do we just need some services or a flexibility that any service can do that when it's appropriate and when it's needed? But not all services do it all the time. I think those are really important questions to ask and to explore as we go forward. Does that answer your question, Francis? You're very welcome to come on and have a chat.
Speak.
There is a question about whether you would like more examples, Sam, sent through to ECA.
Love more examples. I think that would be great.
Yep.
Yeah. Because I think often those examples have come about by people who've been innovative and made it work despite the fact that that's not how the systems are set up, and that's why they're quite rare. And so I think if we want to start to see those models looking mainstream, we need to keep putting them in front of government and say, find a way to make this work, find a way to authorise practitioners to work like this. So yes, very happy to have more examples. I've got too excited and the room's getting really hot. So,
Sam, there is another
I'm just
question.
a woman of a certain age. I'm not sure which one it is.
You're wound up with a question.
I'll edit that out of the video, Sam.
Thank you.
There is another question about the clarification of the different levels of support. If there will be any requirements to move from one level to the next. So, for example, parenting programs before more targeted supports.
I think that we have to be, will state and territory governments impose that? I hope not. Yeah. I think our sense of it was it needs to be a lot more fluid and flexible. And we talked about this quite a lot in terms of if we have a child who's 2, who is having some speech difficulty, the response to that can be very soft and can be very collaborative, across the early childhood setting. An early childhood intervention specialist, we might start with just working with the family. We might start with just identifying, nursery rhymes and songs to sing, the things that might help that child with their speech. But if we have a child come into preschool at 4, non-verbal, now we've got a year before school transition, the response needs to be quite different, right? It needs to be much more quick, and it needs to be much more significant, and we need to have a really good, thorough, evidence-based response that is going to involve multiple professionals, I imagine. And we actually don't know if that child has a disability. We don't know if that child is actually, has experienced trauma or has a disability or is a genius and is going to start talking in full sentences any minute now, but hasn't yet. Like we just don't know. So we need to have the flexibility to be able to respond effectively in the moment and not put families through some kind of diagnosis barrier. I think that's been well discussed across the advisory group. We obviously do need to sort it out before that child turns 9, because there needs to be a decision about whether that child pathways into the NDIS or whether the interventions that we're able to provide in those early years, combined with good quality schooling, is going to be enough for the child to thrive. And there will not be the need for a diagnosis of disability or a functional assessment. So we have a limited time frame, but it's different for children at different ages, and it's different for children with different developmental challenges.
Thanks, Sam. There's a couple of, I think, examples people are putting in there. I would also obviously encourage you to contact ECA directly, because the chat is not necessarily giving everybody's details. Just seeing if we've only got 2 minutes to go, so just seeing if there is another question. I don't know, Anoo or Susanna, if you've seen anything.
There is just not a specific question. Well, it is a question about whether we will make the questions of the chat available to people.
You mean just the comments in the chat?
Yeah.
Yeah. I mean, I guess we could do that and just attach it. What we will do is de-identify, obviously, and just put where people have written the information. We have. I don't think we've received permission from everybody who's in the chat to actually publish their comments. So yes, we can do that.
Mm-hmm.
I'm just going to share my email because I'm very happy for anyone to reach out with examples. Go for it. Merrin, I think your example from your rural service sounds really terrific. So please, I think the more good practice examples we can share and spotlight, the better.
Yeah. And there is, and I know you mentioned it at the beginning, Sam, about the educator knowledge around development and identifying early developmental concerns. And there's just a note around people, the importance of having that level of understanding of development. And certainly I can probably say that that's some of the work that PRECI, working with the early childhood education space, and ECA is really keen to do, because again, I think you've highlighted so well the need for the interprofessional collaboration here. For this to work, it's going to really require us working with each other and using the skills and knowledge across all of the areas that people come from, getting those broad perspectives as well as very specific knowledge bases. Well, look, we're at time. There's a few thank yous coming through. I would expect people are needing to leave. So I'll just say thank you very much, Sam. That was great to have that update. I think it's important what you've highlighted, that we're all working together. We all have the best outcomes of children and families in mind. And I really liked the point where you were saying some people are just doing it no matter. They're working out ways, they're problem solving. And I think together we've got a very resilient and a very knowledgeable fields that we're both representing. So I think, together we can make this work for the children and families in our different states and territories. But keep an eye out, everybody. We will look at how we can work together and support. And I know Sam we're definitely keeping an eye on what is happening in each state and territory.
It might be good, Denise, to regroup after October when we've got a bit of a better sense of each jurisdiction. I feel like I can't answer everybody's questions, but hopefully by then we'll have a better sense of what it's going to look like.
Yeah. We'll start to get glimpses of that. So thank you, everybody. Yes, the recording will be available on the PRECI website. And have a great day and have a great weekend. Thank you again, Sam. And thanks, Anoo, as well.
Thanks, everyone.
See you. Bye. Thanks, Susanna. Okay, let me stop the record. That's the first thing.